So the article I'm presenting today, and thank you for your patience on this, the article I'm presenting today is co-written with Professor Normand Boucher, who saw earlier in the conference, and it's part of a postdoctoral internship with the Center for Interdisciplinary Research on Rehabilitation and Social Integration and the Center for Research on Work Disability Policy. So in this article, we analyze disability policies with the objective here of comparing mechanisms for social integration of working age persons with disabilities in Canada. And so that is to say 15 to 64-year-olds. And so specific focus in the article is given to policy provision and the types of measures adopted, with direct funding being a key issue. And so direct funding is a policy approach, for those who don't know, that allocates public funds to people with a disability or to a designated third party with the goal of allowing them to decide who is hired to help them meet their needs. And so this approach to disability grew out of the independent living movement, and it's also sometimes referred to as consumer-related care. And so in theory, it's intended to allow for greater freedom of choice for beneficiaries. Now, that being said, disability in Canada is already a patchwork, and it's only partially adopted this stance. And so in the context of partial adhesion to a policy idea, we ask what types of policy provision and measures are most common in Canada, and how do they work? And so first things first, why this focus on working age individuals? So just to briefly explain, the narrow choice of target population is because working age individuals with a disability, they're simply more vulnerable to poverty and exclusion, even when they're in employment, than the rest of the working age population. This means this population relies heavily on government support, with 2/3 of income coming from government transfers. And most of this support comes in the form of provincial income assistance. Statistics also show that this group represents a significant portion of Canadian society. So for example, a 2017 Stats Canada report shows that 22% of Canadians 50 and over live with a disability. And so you can see evidence of this in the table here, which subdivides the Canadian population over the age of 15 by age and sex. And the disabilities that people experience, of course, are wide-ranging. They include both mental and physical incapacities. And so these characteristics are unfortunately associated with lower employment levels. And the employment rate for working age persons with disabilities is 21% lower than the general population. So as you well know from the theme of today's conference, acknowledgement of these issues has led to an initiative on the future of work disability in Canada, with the overall goal being to discuss the challenges and opportunities for improving work policy, as well as increasing our knowledge and research on the issue. And so this article is part of this broader initiative, which has received funding from the Social Sciences and Humanities Research Council of Canada. And so to respond to the research question, what types of policy provision and measures are most common in Canada and how do they work? A qualitative comparative approach is used. And so official government documents were gathered from the federal, provincial, and territorial governments as the main data source. And so this includes policy descriptions, objectives, and eligibility criteria. Policies included those for which working age persons with a disability may qualify. And so these policies were then, we gathered data, we coded them, and then we compared them using hierarchical cluster analysis. And so both analyses use what we call agglomerative hierarchical clustering. And so this is simply because this method is best for identifying small clusters, which is appropriate in the Canadian case. A second qualitative comparative analysis of disability strategies and poverty strategies were then conducted in 4 provinces. These are British Columbia, Ontario, Newfoundland and Labrador, and Quebec. And so in the first step of the analysis, policies were classified. The first distinction is according to policy provision. So that is to say, do these measures provide money or services to beneficiaries? And so the objective is once again to get closer to this notion of direct funding. The second distinction is made using Fujirola's classification of disability measures. And so this classification sorts policies according to which personal habits, personal factors, and environmental factors are considered to be key elements affecting social professional integration. So I've added the classification here in this slide for your information. And essentially what it argues is that these policies can be classified into 6 types. Now, we decide to focus exclusively on what we call assistance measures. So these ones right here in the red box. And so these include substance, health, and integration measures, which I'll explain a little bit more later in the presentation. But what you should know is these measures are financed by public funds, and they're accessible to all, regardless of the cause of disability. And so by making this choice, we remove all insurance-based policies that might require contributions. We also remove all policies that could take the cause of disability into consideration and could lead to legal action. And we remove any private sector support services. So our focus is really on the basic safety net for individuals with a disability in Canada. And our objective is to provide a detailed portrait and comparison of the types of benefits that Canadians with disabilities may have access to, and how this aspect of the social safety net may vary across the country. So as I mentioned earlier, Canada's disability policies are known to be a patchwork. So the federal government has attempted to coordinate disability policy through various funding initiatives and reports, but this has not led to a coherent national policy. Furthermore, there's no explicit national disability legislation in Canada, and so we have both levels of government that have jurisdiction over programs affecting people with disabilities. So for example, you can think that the federal government has the exclusive right to legislate on issues such as employment insurance and old age security, whereas you'll find that provincial and territorial governments are responsible for healthcare, education, training, social assistance, and social services. And so what this means is Canada lacks a coherent disability policy, and protection is going to vary across the country. Coverage and conditions, as well as eligibility criteria, they're also going to vary between the provinces. And so to begin to understand this diversity in the context of policy provision, we performed this first hierarchical cluster analysis on the provinces. So to make this more obvious to you, what I've done is I've included a figure which shows the specific breakdown for policy provision found in the provinces and territories. And as you can see, a majority of provincial and territory governments, so 9 out of 13, they provide money rather than services. I've also taken the liberty of adding 2 parentheses so you guys can understand both clusters that we find. Now, we didn't include this in the figure, but you should also know that we did investigate the characteristics of federal policies, and findings indicate that the federal government primarily acts on disability policy through fiscal measures and funding to the provinces. And if we look at the federal government's measures that are specifically targeted to individuals, we find that they all represent tax credits and deductions. And so this means that they have an effect on individual finances by basically recouping those costs related to a disability. And so when we look back at the provinces, because of this division of powers I mentioned, provincial and territorial governments, they include a wider array of interventions such as income and employment support, health services, and tax credits and exemptions. And so what this first analysis does is it allows us to distinguish between 2 provincial clusters. The first cluster emphasizes monetary provision, and then the second cluster is more evenly balanced between providing money and services. So to further distinguish between the provinces, we performed a second classification according to disability measures, and this is visible in figure 2. So of the measures classified, we had 151. We find 60 of them, or 40%, are what we call integration measures. And so these affect individuals' environment, and the objective here is to lead to social and professional integration. The second most important type, with 54 out of 151 measures, or 36%, are what we call health measures. And so these measures provide basic health needs, including services and materials. And then finally, with 34 out of 151, or 23%, are what we call substance measures. And so these provide basic economic needs and tax relief, and these prove far less popular in Canada. So to make more sense of these results, we can also look at the breakdown within the provinces, which can be more meaningful. And in so doing, what we find is health measures are the most popular with an overall proportion within these provincial measures. So they account for half or more of the measures provided in 6 of the provinces. This is then followed by integration measures and finally substance measures. And so as you can see in figure 2, all the provinces except for Prince Edward Island mainly provide health and integration measures. And while not visible in the figure, we find a completely different trend at the federal level. So here's substance measures, so meaning these basic economic needs and tax relief, they actually account for a majority of what we find at the federal, or what we find in federal policies. So once again, we performed a hierarchical cluster analysis with the objective of determining similarities and differences between the provinces and territories. And so this includes both policy provision, right, money or services, or measure type. And so this process identifies 3 clusters. So I've added the plot here just for your own benefit. But the first cluster you should know is the largest, both in the number of provinces and percentage of the Canadian population. So disability policies in these provinces generally tend to emphasize money for policy provision, and most of the provinces in this cluster skew towards health type measures over integration and substance measures. Policy provision in the second cluster also tends towards monetary service provision, but to a lesser degree. And the provinces in this cluster also show a clear preference towards what we call integration type measures. Finally, we have the third cluster, which is the smallest. These provinces provide the most services relative to the rest. However, they don't seem to, or they don't appear to show a preference when it comes to measure type, which is more evenly distributed between health and integration measures. So from these pan-Canadian results, we can then pivot towards our qualitative comparison of 4 provinces based on their poverty and disability strategies over the past decade or so. And so the objective is to provide more context to our initial findings. And in so doing, we find that Quebec and Ontario, 2 provinces that are clustered as having monetary service provision and this emphasis on health measures, they also have specific strategies to increase employment for persons with a disability. And so these provinces have had work incentives for much longer, and they also have recent disability strategies that emphasize employment for people with disabilities. Now, if we look at British Columbia and Newfoundland and Labrador, these provinces do not, pertain or are not part of a cluster that emphasizes monetary provision to the same degree, and they also favor integration measures. And we find that they have fewer comprehensive employment policies for people with disabilities. So that doesn't mean that we don't find what we call work incentives in these provinces, but they're definitely less developed. And the strategies for people with disabilities emphasize other aspects of integration, such as inclusion or individual development. And so to conclude, this analysis on policy provision shows that money is the main provision of the policies analyzed. In fact, if we look at it, 10 of the 14 governments mainly provide money over services. And so what this does is it provides evidence that Canada does indeed subscribe to elements of direct funding. The Quebec government, for your information, is the most extreme example of this. And so this does confirm the literature that describes Quebec as being a consumer-oriented province. If we look at the analysis of measure type, we find it's more evenly distributed between integration and health measures being the most common in the province and territories. And so this means that these governments, they tend to emphasize measures that provide basic health needs and also measures that affect the individual's environment with the objective of leading to social and professional integration. And so these trends are made more obvious with the hierarchical cluster analysis, which reveals these 3 clusters within the provinces and territories. And the analysis shows that provinces that mainly provide money can be further subdivided into those who that prioritize health, and then those that prioritize integration measures, with a much smaller set of provinces mainly providing services to their citizens. And finally, if we look at poverty reduction and disability strategies, we find further distinctions between these provinces. So for example, both Quebec and Ontario share what we call work-oriented disability strategies, whereas BC and Newfoundland and Labrador, they have more global strategies in which work is one priority, but only one among many. You should know that Ontario is the most workfare-oriented, or it has the most workfare-oriented disability policy, with low benefits, stringent conditions, and the promise of reforms under the Ford progressive conservative government. Quebec's newest strategy, it maintains its work incentives, so it maintains its stance towards people with a disability. However, the strategy also argues that employers have a large role to play in this issue. So this might be related to the role or the important role that social partners and community actors play in social policy governance in Quebec. So to conclude, I just want to say thank you very much for your time, and I welcome your questions afterwards.